screen, right?
Yes.
Okay, thank you so much. Yeah, good afternoon, everyone. I'm Dr. Bijina Shrestha. I'm pediatric neurologist and epileptologist and Akron Children's Hospital. And before I start my presentation, I would like to thank organizer for giving me this opportunity. And I'll also like to thank my chair, Dr. Coleman, who's here. So I have like 2-month-old who is not doing so well for the first time in life. So Dr. Coleman is here as a backup just in case if I need him. And thank you so much, Dr. Coleman, for that. And I would also like to thank my entire epilepsy team in Akron Children's Hospital for being there as a backup for me. So after that, I would like to start with my presentation. So starting with the brief background, let me see if I can. Yeah. Yeah, so starting with the brief background about the COVID-19 infection or virus. So this coronavirus disease 2019 is an infectious disease caused by severe acute respiratory syndrome or SARS, coronavirus 2. And as we know, it caused like is the most significant pandemic in human history. And the first outbreak of this disease was in late 2019, and it rapidly spread globally. And I just want to jump straight ahead to like how this COVID-19 affect the brain. And here you can see that there's a special receptor called ACE2 receptor, and this virus uses this receptor to enter different parts of our body. And this receptor is present most abundantly in the lower part of our respiratory tract, and it is also present in other part of our other organs in our body, including brain. And in brain, the receptor are most present in the part of the brain called brainstem, which controls like breathing and also controls our heart as well. And in addition to that, the virus can also directly enter the brain without the need of this receptor through the part of the brain called like olfactory tract. So basically it's a part of the brain that helps with the smell. And now going to like how this virus can cause seizure or epilepsy. So as we discussed earlier, it can enter the brain through this like special receptor, or it can enter the brain directly, and then it can cause like inflammation, infection, and that itself can cause seizure and worsening of epilepsy, and also can cause epilepsy. And other way that it causes seizure is like it can cause the infection itself can cause fever, and that can cause seizure. And in severe cases, this infection can also cause like clot all over our body, including brain. And when we have clot in the brain, it causes stroke, and stroke can also cause seizure. And this infection can also cause like electrolyte imbalance sometime, which can cause seizure. And then the stress related to this infection, and then the whole pandemic itself has also shown to worsen seizure in the patient who already have a history of epilepsy. So going to the symptoms about this COVID-19 infection, I think all of us kind of know this by now, that the symptoms can vary from being like completely asymptomatic, meaning that you can have an infection but might not have any symptoms, to like very severe respiratory infection that can eventually lead to that. And among the patients who have the symptoms to COVID-19 infection, studies have found that up to 40% of them can have neurological symptoms. And the most common neurological symptoms are like headache, loss of smell, taste, muscle weakness, pain, and rarely they can have this myopathy or inflammation of the muscles or dysregulation of autonomic nervous systems, or it can also affect blood vessel in our brain. It can cause seizure, movement disorder, encephalitis or inflammation in our brain itself, and GBS. It can also affect optic nerve as well, can cause inflammation of the optic nerve. Now, talking briefly about the vaccine of COVID-19. So in December of 2020, the FDA authorized the emergency use of 2 mRNA vaccines. And since then, the World Health Organization have evaluated multiple vaccines that meet the criteria for safety and efficacy. So before we had vaccine, we obviously were concerned about the effect of COVID itself in epilepsy. And with vaccine, they were also concerned about like safety and efficacy among the people with epilepsy. And we are going to discuss about this later in presentation, and we're going to I'm going to show you like what are the data that we have so far regarding this. So going to epilepsy, we know that epilepsy is like one of the common chronic neurological disease characterized by spontaneous recurrence of unprovoked seizure. So basically, unprovoked seizure can basically, to have epilepsy, you need to have unprovoked seizure and have a risk of recurrence as well. And the prevalence of epilepsy is somewhere from like 0.7 to 1%, with high incidence among elderly individual and children. And since this COVID-19 pandemic, there has various studies been done to see the effect of to know the effect of COVID-19 on epilepsy, and we're going to discuss about that in this presentation today. So I just wanted to briefly talk about how this COVID pandemic, especially during the COVID crisis, affected the epilepsy care. So different data have shown that the activities related to epilepsy care were drastically reduced during this peak of pandemic, and data have even shown that it was reduced to as less than 10% to accommodate to take care of the patient with COVID infection. And the patient who was admitted with epilepsy were also discharged early on, and the epilepsy surgery were canceled or postponed for later on, and then anti-seizure medication vein and VNS setting changes were held as well because of the uncertainty. Like we didn't have like much information at that time when the COVID initially came in, and it was peaking at that time. And the EEG and other diagnostic tests were also limited, and the study also showed that like 75 to 90% decrease in EEG during that peak time. And there was like limited new and follow-up appointment for epilepsy care. And even if there were like appointment, it was converted to televisit, which has its own pros and cons. And they also saw that there was some like communication inconvenience due to technical problems during the televisit in different part of the world. So overall, what it did was it delayed the diagnosis and management of epilepsy, and it did like negatively impacted the management of epilepsy overall during this like COVID pandemic, when it was like really bad during early 2020. And so I just also wanted to discuss like how it affected like epilepsy treatment per se. So during this COVID infection, like some of the people who were on taking their like regular anti-seizure medication, they had to be changed because there were certain medication that had interaction with COVID therapies. And they also found difficulties with diet therapy during this like peak of the pandemic. They had difficulty obtaining the diet for their epilepsy management, and epilepsy surgery was also affected. So all the elective surgeries were postponed, and even for emergency surgery for epilepsy, they were like scared or worried. And data also showed that surgery during like active COVID infection was found to have like high post-operative mortality rate, especially in more than 70 years of age. And they were also concerned about whether this like immunotherapy and steroid that we sometimes use for like refractory or certain kind of epilepsy will cause like increased risk of COVID. So I didn't find the study that was done in epilepsy patient per se, but there was one study done in the patient who was taking steroid long-term for inflammatory bowel disease. And it did so that these patient population, just because they were taking like a steroid for long-term, they were at increased risk of COVID infection because of that. And now coming to like mental health impact that this like pandemic caused on the patient with epilepsy. So many studies show that the patient with epilepsy were more susceptible to psychological stress, and stress in patient with epilepsy were as high as like 54% as compared to 13% in general population. And the risk factor that caused this like more psychological stress were time of exposure to information about COVID infection, like if the patient were infected with COVID-19 early on, they tend to have like more psychological stress, given that there was like so little information about COVID-19 and how it would affect them. And the other risk factor were like and the stress was found to be more in the people with like drug-resistant epilepsy, and in the people who has been recently diagnosed with epilepsy in the last 5 years, and in people who have a history of psychiatric disorder. And then it also depended on occupational status of the patient. And overall, lots of studies have shown that this mental stress can and also have shown to increase the seizure frequency in the patient with epilepsy, and also it has contributed to depression and other mental health problems. So this is just a diagram I wanted to show you like how this COVID-19 impacted various aspects of care of epilepsy, from like diagnostic, EEG, to taking care of the patient, to treatment, mental health, education, and everything out here. Now, after this, I just wanted to take my presentation and try to answer some of the questions, like common questions that we have related to like epilepsy, in terms of like when the patient have like COVID-19 or during this like whole period of like COVID-19 pandemic. So the questions that I'll try to answer today is, the first one is like, are patients with epilepsy at higher risk of COVID infection? And the second question that I'll try to answer is like, does COVID infection cause acute symptomatic or seizure? And does COVID infection worsen the seizure in the patient who already have epilepsy? And the fourth is, does epilepsy comorbidities increases the risk of infection? And other question is like, does COVID infection cause epilepsy itself? And does COVID vaccine worsen the epilepsy in the patient? And the last question that I answer is like, does COVID increases the risk of febrile seizure in pediatric population? So I'll try to present the data I've found regarding my first questions. So are patients with epilepsy are at higher risk for COVID infection? So early on, when in like 2019 and early 2022, CDC suggested that epilepsy may be at higher risk for COVID infection despite lack of evidence. But however, they removed that statement later on as we gathered more information. So in early 2020, the study was done in like Spain and Italy. They did the study in like 3 tertiary epilepsy care center, and they saw that among like 5,700 patients with epilepsy, only 14 of them tested positive for COVID-19 infection, which is way less than 1%. And among them who were tested positive for COVID infection, they didn't have any obvious impact on epilepsy. And none of the patient, they admitted like more than 2,000 patients with COVID infection, and none of them experienced seizure as the early symptom. And there was another systemic review article that showed that the rate of COVID-19 severity in people with epilepsy was lower than other neurological disorder like dementia, cerebrovascular disease, and multiple sclerosis. And there was this another study that was done to see the case fatality rate, or to see the mortality or death related to COVID infection and epilepsy. And in this study, they had like 21 patients, and they saw that 5 of them, or 23% of them, died. But again, in this, all of these who died, they also had like hypertension. It was not only like epilepsy. All the patients had like hypertension as the comorbidities. So, and there was another study that saw that COVID-related mortality was not different among patients with epilepsy when they compared with the general population. So, to answer the questions based on the data that we have, are the patient with epilepsy at higher risk for COVID infection? So in conclusion, we can say that epilepsy does not seem to increase the risk. Epilepsy itself does not seem to increase the risk for COVID infection. Now, going to our second question. Does COVID cause acute symptomatic seizure or acute seizure, or seizure during when they're initially infected with COVID infection? So seizure can be triggered by any fever related to infection, including COVID-19. And various studies have shown that the incidence of like acute seizure due to COVID-19 can range from less than 1% to 4.3%. When we compare this incidence to the other coronavirus-related diseases like SARS, which had the outbreak in 2002, the incidence of seizure with SARS was 2.7, and with MERS, or Middle East Respiratory Syndrome, which was another coronavirus-related pandemic in 2012, the incidence of seizure was like 8.6%. And and there was lots of other data as well that showed that acute symptomatic seizure, or seizure, is not one of the common presentation of COVID infection. So there was this one data that I found where they looked at like 439 patients, and among 439 patients, they found that 50% of the patient had like neurological manifestation, and among that 50% who developed like neurological manifestation, 8.6% is a patient presented with seizure. And when they tried to see what was the cause of seizure, they found that 73%, or 14 of the patient, had like primary pathology, meaning that they had some brain injury or brain lesion or injury related or unrelated to COVID infection that caused seizure. Like a few of the patient had like encephalitis or inflammation of the brain that was related to COVID, and some of them had stroke post-COVID, and one of the patient had the history of like meningioma, and they had seizure after COVID infection. And here you can see that like only 5% of the patient, or 26% of the patient, had seizure that was directly related to COVID infection. And among them, 60% had newly developed seizure, and 40% had seizure in a patient who already have a history of epilepsy or had exacerbation of the seizure. And there was this another study article that was reported in 2022, and here they have a little bit slightly higher incidence report of seizure with COVID infection. So they studied this in like 232 patients, and they found that 11.2% presented with seizure, and among them like 26 or almost 30% had like prior history of epilepsy, and around 70% had no history of seizure. So based on the data that we had, does COVID cause acute symptomatic seizure? So it does, but it's not one of the common presentation based on our data so far. And my other question is, does COVID infection worsen the seizure in patient with epilepsy? So several studies have been done, and it has shown that there was worsening of seizure during COVID-19 crisis, irrespective of like COVID-19 infection, whether they had infection or not. This like quote pandemic led to worsening of the seizure, and the increased seizure varied from like 8 to 35%. And there was one study done which looked specifically at the patient who had epilepsy and got infected with the COVID-19 infection. And in that study, they found that the incidence of this like seizure in those patients who had epilepsy was as high as like 34%. And the most common risk factor that led to worsening of the seizure were number of anti-seizure drug medication that they were taking. So if they were taking like multiple medication, anti-seizure medication for their epilepsy at baseline, they tend to have like worsening of seizure with COVID infection. And people who had like higher seizure frequency at baseline also tend to have like worsening of the seizure if they had COVID infection. And the other risk factor were like sleep related problem and then mental stress. And interestingly, there was one study that I discussed earlier as well, that was done in Spain and Italy during like this when the pandemic was at peak. It showed that there was no change in seizure frequency, but again, it could be related to lifestyle modification. Because of lockdown, they might have had like improvement of sleep quality during the lockdown, or increase like drug compliance, or it could just be that they were not or they were hesitant to reach out for medical care, even if their seizure was not was worsening due to the fear of COVID infection. So based on the data, so does COVID infection worsen the seizure in patient with epilepsy? Yes, it does. And data showed that it can be as high as like 35% of the patient with epilepsy. And our next question is like, does epilepsy comorbidities increases the risk of infection? So various data have showed that these comorbidities, if the patient had other comorbidities with epilepsy, they tend to be at increased risk of infection, and also they tend to have severe symptoms. And those comorbidities that led to severe symptoms were like in elderly population, elderly people with epilepsy, and certain comorbidities like hypertension, diabetes, heart disease, obesity, lung disease, and cancer. And they also saw that the symptoms tend to be a little bit severe in the patient who had epilepsy due to stroke, because they tend to be like more dependent and also had like weak immunity. And in pediatric population, they saw that the patient who had like epilepsy with neurodisability and brain lesion, they were at risk of having like pneumonia and respiratory complication when they had like COVID-19 infection. So to answer our question, yes, the comorbidities associated with epilepsy can increase the risk of infection, and also they tend to worsen the symptoms if they get COVID-19 infection. So my other question was, so does COVID infection cause epilepsy? So we don't have much data regarding this. So there was this one article that was published in 2023. So they tried to look at the incidence of epilepsy and seizures 6 months after COVID infection, and they found that the incidence was low. And in this study, what they did is like they compared the incidence of seizure with COVID infection in comparison to influenza infection. So when they compared like seizure and COVID infection with influenza, they found that the incidence was like of seizure was 0.8 in like within 6 months after COVID infection, and the incidence of epilepsy was 0.30%. Which is low, but again, when they compared it with influenza infection, they found that this incidence was a little bit higher compared to influenza infection. And in this study, they found that the younger population, the children who were like less than 16-year-old, were at a little bit higher risk of having seizure and epilepsy in 6 months. And the incidence was not related to severity of infection. They found that the people who were not admitted with COVID infection also had seizure and epilepsy. And so this study was done like 6 months after COVID infection. So this study has its own limitation because we don't know what happens or what will happen after 6 months. We don't have a data about that. Another thing, limitation of the study is like they didn't compare this incidence to like general population, and also they did not try to find the data whether the vaccine status or the certain variant of the COVID infection affect this incidence, or if that contributed or how it affected the incidence of seizure and epilepsy. So this is a good data, and it assures us that the incidence is low for epilepsy and seizure in long term in 6 months. But again, we don't have long-term data, and we still need like more information to know more about it, to know whether like COVID infection might cause like epilepsy or seizure, or if you have that more incidence of it in future. So we definitely need more data in that regard. Yeah, so trying to simplify the answer, yes, it can cause epilepsy, but at this point we know that it's rare. But again, like I mentioned, we need more data in this regard in future, and that might change if we have more data in future. Now, the sixth question that I'll try to answer is like, does COVID vaccine worsen epilepsy? So the study have found that only a small portion of patients with epilepsy, that's like 6.2%, had worsening of seizure. And among the like 6.2%, more than 60% had another identifiable cause for worsening of seizure. And there was another study done in China after first dose of vaccine, which showed that there was worsening of seizure in like around 17% of the patient with epilepsy. But again, these patients who had worsening of seizure, they also had this like other risk factor. Like if they had increased seizure burden at baseline, they had worsening of seizure after vaccine. And it was not clear in the study whether that was related to like fever that some people might have after the vaccination or not. So it was not clear. And the other risk factor were like improper anti-seizure medication administration, which it itself can cause worsening of the seizure. And then other risk factor was disrupted sleep routine, which again itself can cause like worsening of the seizure without the vaccination status. And then there was another study, again done in China in 2021 among 981 patients, which did not show difference in side effect to vaccine in people with epilepsy when they compared with general population. So to answer our question, does COVID vaccine worsen epilepsy? So based on our data, it seems that vaccine is relatively safe for a patient with epilepsy. And going to our last question, does COVID increases the risk of febrile seizure in pediatric population? And there was data collected from more than 8,000 patients among like 0 to 5 year of patient with COVID infection. And they found out that only 0.5% of the patients were diagnosed with febrile seizure. And among them also like 25%, only 25% required hospital admission and 9% required like critical care service. And there was another retrospective study done among more than 27,000 patients, which did not show any increased risk of febrile seizure secondary to COVID infection when they compared with other causes. However, with like Omicron variant compared to the Delta variant that was there before, with Omicron variant, it did show that there was slightly higher incidence of febrile seizure, like 5.7%, and among them 60% required admission. And again, we know that with Omicron variant, compared to the Delta variant, it affected the pediatric population more compared to the other variant. And the risk factor that they found that led to like increase like febrile seizure in pediatric population was like higher body temperature and prior history of febrile seizure, and then blood marker of bacterial infection. These all contributed to the higher risk of febrile seizure when they have like COVID infection with Omicron variant. So to answer our question, does COVID increase the risk of febrile seizure in pediatric population? It does, but not common. Yeah, so these were a few of the questions that I tried to answer. Yeah, and this was my short presentation. So if you have any questions, I'm ready to take that. And I think we do have some.
Thank you so much, Dr. Shrestha.